Millions of Americans across the country, including some here in Kern County, could soon find themselves scrambling to find health insurance as a pandemic-era Medicaid policy comes to a close, with the potential for even broader cuts on the horizon. At the beginning of the COVID-19 pandemic, lawmakers in Washington offered states a boost in funding if they stopped cutting people from Medicaid, which is government-funded health insurance for low-income Americans. As a result, the number of people on California's version of the program, Medi-Cal, rose by about 20%. This month, states are required to restart eligibility checks, which the federal government estimates will result in about 15 million people losing coverage. The concern is that eligible Californians will fall through the cracks because they don't respond to the check process or have moved since 2020 and don't receive a notice in the mail. Additionally, because these checks were paused for 3 years, many on the program may have changed jobs or houses or had shifts in their households, all things that could impact one's eligibility and leave someone rushing to find new coverage. According to state data, over 505,000 Kern County residents were eligible for Medi-Cal as of February, and local officials are urging preparation.
We do have thousands of cases with eligible individuals. You know, these are the elderly population, disabled families. For the last 3 years, there have been no recertifications. So 3 years later, a few households will have those changes that could drastically impact their coverage.
It comes as larger cuts to Medicaid could be in the works as the House GOP under Bakersfield Speaker Kevin McCarthy looks to cut government spending, as you just heard, in exchange for raising the nation's debt ceiling, a stance he outlined in a speech on the House floor yesterday. McCarthy spoke about adding stricter work requirements to government programs such as Medicaid.